Good afternoon. My name is Keith Hovis, and I'm the Director of Communications for the Humphrey School of Public Affairs. Thank you so much for coming to today's Humphrey Summer Seminar Series. We've been having these conversations every Thursday throughout the summer at noon. A great time for you to kind of grab your lunch and sit down and hear some cool policy discussions like today's. Today's seminar explores the impacts of COVID-19 induced economic downturn and the federal response to that downturn. In particularly, it will explore the effectiveness of the policy response, comparisons to the responses of other countries, and considerations for future policy responses. We are so lucky to have economist Angie Fertig with us today, as well as our two moderators who are also MPP Master of Public Policy 2020 grads, Tyler Boesch and Cory Georgopoulos. I know I'm gonna, please correct those names as soon as you can. I apologize, thank you. Tyler graduated from the Humphrey School of Public Affairs in 2020. He concentrated on advanced policy analysis methods and minored in population studies. He also received his bachelor's degree from the U of M in 2017 with a double major in history and global studies. Cory graduated from the Humphrey School of Public Affairs in 2020 as well, with a population studies minor, and she currently works at Hennepin County doing research and evaluation work. So I'm going to turn it over to Tyler and Cory. Thank you so much for being with us, and I'm excited to hear the conversation.
Thanks, Keith. So as Keith said, I'm Cory, and I graduated this summer with my master's in public policy. So Tyler and I were both Angie's TAs last year, which I don't know about Tyler, but that still feels a little weird to say because before I took my first stats class, I was so freaking nervous. But I guess it all worked out in the end, clearly. So as Keith said, I'm currently working at Hennepin County doing research and evaluation work, and I know Tyler is a research assistant at the Fed. Yeah. So we're super excited today to discuss today's topic, which is kind of the broad economic impact of COVID-19 and specifically the US federal response to that. I think that econ is a super useful tool for thinking through some of these policy questions. So we wanted to provide a bit of a breakdown of the issue and then talk about some of the policy responses that the US has implemented. And then discuss a little bit of what more could be done. So we'll also be taking questions, so feel free to send them in the chat and we'll try to address as many of them as possible. So let's get into the heart of the matter. So I think one of the most important things about policy analysis to really be able to understand it is to get to the heart of the problem and fully understanding that. So to get everyone a bit on the same page, we're going to start with a brief overview of some of COVID's impacts, specifically economic impacts. So I'll let Angie take it away.
Okay, I just had a minor heart attack because I think I lost internet, but I'm back. Everything's okay. Okay, I'm going to share my screen. Thank you so much, Cory, for that introduction. Let me just say that we've prepared quite a lot about what we're going to cover because we had extensive discussions sort of beforehand. Let's see, are you seeing my screen right now? Yes.
Yeah, we can see it.
Okay, thank you, Cory. But we're going to take questions towards the end, and I think Tyler is going to, keep track of that and then keep me posted on what questions are showing up. And so, as Cory said, economics and policy analysis are very useful tools for sorting out complex systems. And so it is super helpful. You know, we're all reading the news every day. I mean, I guess I'm obsessed, but maybe I assume if you're Humphrey related people, you're probably obsessed too. But it's a lot of information that's coming at us. And so it's helpful to kind of break everything down a little bit. And so I wanted to start with, a mini lecture just on what is, I can't help myself, on what is the problem first, in order to understand what the policy response has been, and then we can get into, what's the evidence that's coming out about how effective it is. Okay. Okay, there we go. And you can see the next slide, right? I'm doing okay? Okay, so this session that we're in right now, so we're focusing on the economics of everything. I won't be talking about the disease all that much, but because of the disease and the spread of COVID, lockdowns were imposed, and that led to both shifts in supply and demand. And so that's useful to think through, that the businesses shut down to keep workers at home. And so the industries that were particularly affected were those with high contact, and that's mainly service sector. So a lot of travel, there's restaurants, entertainment, haircuts, things like that. And then because workers are consumers, the demand side is also affected. And so we're all, not spending as much as we used to, especially in those services that require high contact. So both supply and demand. And so then what I like to think about is, what are we worried about with supply and demand in this recession? And so we're worried about businesses closing. First, I kind of see it in three buckets, as you see here. I'm worried about businesses closing. And so some of it's okay. Some of it I can deem as kind of creative destruction, that the economy is going to change, behaviors are going to change as a result of this. And so some things are going to decline and some things are going to, have a boom. And so in particular, we're not going to be traveling to DC for a half-hour meeting anymore. We can do that on Zoom. So Zoom is up and, little travel like that is down. Some of it could also be good in the sense that any firms that were not very efficient aren't going to make it, and firms that are strong are more likely to make it. So some of it's okay. However, what we're worried about, the part that's not good, is if we lose critical businesses that we need. And so in particular, businesses that we want to still be there when we come back, like airlines. So we don't, we might not travel as much, but we're going to need to travel a little bit. So we need airlines to survive. We need, one article I read said small colleges are in big trouble, that they might not be able to weather this. And small colleges are important because that's where a lot of low income or first generation students go to school. And so if they start collapsing, we might have a harder time getting people to get a college education if they want it. Another article I read talked about small newspapers, that small newspapers may have trouble weathering, so local newspapers. But local newspapers are important in that there's studies that say that they keep local corruption at bay. And so if local newspapers are collapsing, we might see, other kinds of problems. And so we need to kind of make sure that, critical businesses stay afloat. We're also worried that in general, small businesses might not make it. So small businesses, aren't going to have the cash reserves to make it like big businesses. And so if small businesses all collapse, then all we're going to be left with is big businesses, and that's not good for competition or for variety. So those are the business kinds of things that I'm worried about.
Angie, can I jump in too?
Yes, please.
Just also you talking about small businesses, there's not a lot of data yet out there, but anecdotally, a lot of BIPOC owned businesses have been struggling extra hard during the pandemic. And that's partly in part because they've had difficulty accessing the paycheck protection, which we can get into more too. So that's also really important.
Thank you for bringing that up. That's a very good point. I did recently see an article that talked about how Black-owned businesses in particular are really struggling. And we will talk about the Paycheck Protection Program. So that's coming up soon too. So thank you for that. Anything else? Anybody wants to jump in? Tyler? No? Okay. I got lots to go. So, okay. So then on everybody's mind are job losses. In America, most people, or a big fraction of families, live paycheck to paycheck. And so as soon as that income is gone, we're very worried about evictions, not being able to afford your rent or mortgage, not being able to afford food. And so those are, short-term problems that can have long-term consequences. So once you fall into problems like that, it can have long-lasting effects on your family's ability to get out of poverty. And so the stress of evictions and hunger are very hard to bounce back from. chronic stress, there's more and more awareness that leads to chronic health problems, which make it hard for you to work. When you're in poverty, it's hard to invest in children as much as you would like to. The resources aren't there. And so that's hard, to have the next generation do better. And so we're worried about long-term impacts on poverty. We're also worried about inequality. I mean, inequality is already a problem pre-pandemic, but this pandemic recession has an impact of increasing it even more, just because higher income workers are the ones who are able to work from home more than low income workers. And so they're able to weather the economy better, and the industries that are hurt, these high contact service industries, disproportionately have low wage workers and workers from, African American community and for Hispanic community. And so those populations are being hit a little bit harder. Finally, one area that's not getting as much attention, or you don't see newspaper articles about it every day, is state and local government. So because incomes are lower and consumption is lower, both income taxes are going to be lower, so revenue to the state government, and also sales taxes are lower. And so government revenue, state and local government revenue, is hit really hard. And a lot of states had balanced budget requirements. And so in order to balance their budgets, they're going to have to reduce services or raise tax rates. And they're critically needed right now. And they're doing a lot of the hard work in getting, services to people who need them. And so that's another area that I'm really worried about and paying attention to. So then I wanted to say a little bit about the features of this pandemic-induced recession that aren't in normal recessions or are exacerbated in this recession. So one is job searching isn't, ideal right now. It's, dangerous to be out there pounding the pavement. We want people to stay home to reduce the spread. And so it's not a normal kind of recession where we're like, just get out there and get a job. Another feature is public schools are closed, so it's very hard for parents to work, especially mothers. Or public schools were closed, and they may be closed in the fall as well, or done online. Reopening businesses isn't just about turning on the lights. You also have to put in all kinds of safety precautions now. So more space so that people can distance. You need to have protective equipment. All kinds of different guidelines have to be followed to keep people safe. And then finally, a part that I think is super important is that the recovery, all recessions, it's hard to predict when we're going to bounce out of them, get out of them. But this one has extra uncertainty. It's not just about consumer confidence. It's also about vaccine discovery and testing accuracy and capacity. And so we really aren't able to predict when we're going to get out of this recession. It's hard to forecast what's needed and how much damage is going to be done in this economy. Any other things that you guys can think of that you want to add to that?
You covered it.
Yeah. Okay. So now I just want to kind of go over what the policies have been, just so everybody is familiar with the basic ideas of the policies. And so on the left side over here, you see businesses, and for businesses, in order to, because we are afraid of small businesses, collapsing, the Paycheck Protection Program was put in the CARES Act. So Congress has passed 4 different policies. The biggest one was the CARES Act. And so a big part of that was the Paycheck Protection Program. And what that is small business forgivable loans. So small businesses can come and apply for loans. And the loans, they don't have to pay them back if they bring back their workers or they keep workers on. And so it's supposed to, keep these small businesses afloat, give them some cash, but also keep people working. There are also big business and government loans. And this is more to address we don't want certain types of businesses to collapse because we need them to make it. And so airlines are getting money, national security, like critical manufacturing, things like that are getting money, postal services getting money to stay afloat. Healthcare is a specific type of business that they're getting some money, but it's mainly about COVID testing and things like that. And then in the CARES Act, there was some money for state and local governments. It's not enough, but it was something. This side of the slide is more about what has been done for families and workers and households. And so early on, there was a mandate for emergency sick leave during the pandemic, and it was paid for by the federal government so that firms would do it. Getting much more attention and having a much bigger impact, I think, is the unemployment insurance benefits. So right now, if you're on unemployment insurance, you're getting an extra $600 per week. You're allowed to stay on more weeks, and more people are eligible than normally are eligible for unemployment insurance. And so this has been a big part of the CARES Act. To address hunger and housing, there have been moratoriums on evictions, foreclosures, and utility shutoffs. This has been done at many levels. So the federal government does what it can for, public housing and federally backed mortgages, but state and local governments have been very active in having these moratoriums as well. The federal government did institute waivers for work requirements for SNAP or food stamps and allow states to increase SNAP benefits. They've also increased funding for WIC, which is a nutrition program for families with young children. Senior meal delivery, there's more money for food banks. So they're trying to do things to get people to have food. And then other things that they've done is so this is another biggie, the recovery rate rebate checks. So in April, families with incomes below, $75,000 or $150,000, depending on household size, got $1,200 per adult or $500 per child. And these, have gotten a lot of discussion. You can also call these a stimulus check. And then college, there's been some increase in student aid, and then there was a moratorium on student loan payments. So those are the major policies. I mean, there's a lot more details out there, but these are the biggies. And it's to address the problems that I discussed. There's been some discussion about the $600 a week and, whether it's too generous, because a lot of people are making more money than they make when they're working. But I mean, that's actually a feature. We want people not to be job searching right now. It's not a drawback of that policy. Anything else you guys want to add or point out?
Yeah, Angie, there's an interesting question that came through, and I think it's sort of relevant for where the conversation is going. Just regarding the Paycheck Protection Program and concerns around, who are these forgivable loans actually going to? We've heard sort of reports that they're going to businesses that we wouldn't necessarily consider small businesses, at least colloquially. And so I guess maybe less of a specific question, but just sort of thinking about the implementation concern for all of these different loans. And, there's the one aspect of thinking about this in the policy creation, kind of high order thinking, but then there's also the implementation piece that really complicates things as well.
No, you are exactly correct. And I have there's some new evidence coming out about the Paycheck Protection Program that I want to share later that maybe, you can talk more about at that point. Yes. So the ones I highlighted in blue are the ones I'm going to talk the most about, and they're also the ones getting the most attention right now. So yes, very good point. One thing that Tyler actually brought up when we were discussing prepping for this was, some of these policies aren't super intuitive. Like, why are they structured this way? And so in particular, this unemployment insurance bump of $600 a week, like where did that come from? And then the recovery rebate checks, these one-time checks, like where does that come from? And so these are good questions. I mean, they could have been done in many different ways. And so I would say that the reason why they're done that way is because this is how we've done things in the past. And we were trying to implement things very fast, quickly. And, these are things that are in our arsenal. And so unemployment insurance, I just thought I'd do a quick primer on them because I think they're people are understanding them more now, but it's interesting to see how they work or how they're supposed to work. So it's really a federal state program, but when there's no recession, it's just a state program. It's just this, where if you become unemployed through no fault of your own, then you can apply for unemployment insurance and you get it for a maximum of 26 weeks. And it usually is supposed to cover half of your wages, what you would have earned. On average, it usually comes out to about $333 a week. And it's paid for by taxes on the employers who lay off workers. So if you lay off a lot of workers, you pay more into the unemployment insurance system. A part of the permanent, the federal part of the program is this extended benefits part. So if we go into a recession defined by your state has an unemployment rate of, it goes up to some threshold, then it just extends unemployment insurance. It doesn't really add more to the benefit, but once you reach these 26 weeks, you can get more weeks depending on how bad the unemployment is in your state. And then the federal government pays for some of this. And so this is the permanent, unemployment insurance system. And we call this program an automatic stabilizer, meaning that it's supposed to, when the economy tanks, it's supposed to grow and take care of it. And when the economy gets better, it just gets smaller naturally. And you shouldn't have to do anything. There are triggers that implement it, and it should be fast and implement very quickly. I mean, that's what it's supposed to be. And all means tested safety net programs, they're all automatic stabilizers. Medicaid, when people are lose their job or have problems, then it should be that you're eligible, so you join, and Medicaid expands when people need it and then gets smaller when the economy is doing well. That's how they're supposed to work. However, these systems were set up a long time ago. So unemployment insurance was set up in the 30s, and it doesn't work as fast. I mean, it's kind of an antiquated system. And because it doesn't really increase the benefit level, it really only kicks in after people have been unemployed for 26 weeks. And so since the 1970s, anytime there's been a recession, we haven't really waited for this to kick in. Congress has just done some ad hoc policy to increase it. And so this is just what they do. So they'll pass a law and they increase the weekly benefit. They also add more weeks. And so in the 2007 recession, a lot of weeks were added. And then the weekly benefit actually went up just $25, but it was something. And then this round, they made it, they increased the number of weeks, and they also increased the weekly benefit by $600, which is a huge amount. But it's because they wanted people not to go out looking for jobs, but to stay home. So that's why unemployment insurance is used. And the tax rebate checks, again, this is just something we've done, so we know how to do it, and we could do it quickly. So it's, in my memory, the first stimulus checks I've ever saw was George W. Bush. So in 2001, when he came to office, he did a tax, the economy wasn't doing so well, and he wanted a stimulus check out there, so he cut taxes, and then he wanted it to be very visible. And so he sent out checks to everybody. And then in 2008, when the 2007 recession hit, he did another one of these. And then when Obama was in office, he didn't do a general one to every taxpayer. He did one that was targeted to beneficiaries of federal programs. So if you were on Social Security or Veterans Administration, things like that, you got a check. And so these are just things we've done before. And so that they're easy to implement. They may not be the best, most targeted things, but they're just things that we can do. Any thoughts that you had about any of those? Does that answer your question, Tyler?
Yeah, no, I think it does. And I mean, I think an interesting thing to think about too is a federal program being implemented across a bunch of different states, right? And how differently that looks in a practical sense. I think perhaps in a place like Minnesota, there hasn't been quite as much delay in the increased unemployment insurance benefits as it has been in other states. So I think it's just important to recognize too that even in this really simplified sort of just $600 across the board, that can, overwhelm, whether intentionally or unintentionally, state level government agencies that are then implementing this federal program. So I think it's easy for people at first glance to see it as a very unsophisticated program, but when you consider the implementation piece, I think it becomes much more complicated.
Yep. Yeah, I very much agree with that. Okay.
I had a comment too, not so much a question, but
Okay.
something you said reminded me of this. You said UI was implemented in the 1930s, and I believe it was implemented mostly to help factory workers. And I think it's really interesting that like so many programs in the US do not evolve with the times. And their historical context is not taken, is just not taken into account, so that it makes it really hard to be able to make them effective in our day and age too. And I think we'll see that a lot more with other programs being overwhelmed and affected by COVID.
Yeah, no, that's a very good point. It is true that a lot of our systems are very antiquated. They were set up for something else, and we are just continue to use them because it's, I guess, too much work to redo the systems. So yeah, very good point. Okay, you guys ready for evidence? So this is, I kind of got obsessed. I might have too many slides. But there is a lot of evidence coming out every day about what policies are working and what policies are not working. And so I thought I'd start, cheerful. I have some good news in the beginning. So I would say that income, definitely rose in April when the stimulus checks hit, right? So money did get to people. So the economy isn't doing so well, but in April, when the money hit, and UI benefits probably are also keeping these from going too far down. But this is month-to-month change in personal income. That income grew actually in April. It was a one-time check, and so people are trying to spread it out over time, I think. As a result, spending has also rebounded. So let me explain this figure. So this is how much change in spending. So in January through March, everything was just like it usually is. And then spending just plummeted. And these two lines, the blue line is low income people and the green line is high income people. And so high income people's income is going to, or spending is going to drop more because they, buy discretionary things like, so yacht sales is going really down here, right? But low income people, they are mostly buying basic needs. And so it is amazing that their income or that their spending could drop this far just because they're needing to, all of their money is used for basic needs. So the stimulus paycheck, the payments start being issued right here, and you can see a big increase in spending. So people are now paying their rent and buying food and things like that. And it's been slowly increasing over time. Green line, these people, a lot of them may not have been eligible for the stimulus check, but their spending is rebounding a little bit, but not nearly to this extent. And so there is some discussion about how high income people's spending has not really returned. I mean, it's still much lower than it was up here. And so anybody's livelihood that depends on rich people spending money is not doing well. So right now, but otherwise spending is coming back up. So stimulus spending, it did increase the spending. It's mostly among low income people. Yeah. Okay. Then a nice study came out that the New York Times picked up on poverty rates. And so it looks like the CARES Act really didn't increase poverty. So this is a study out of Columbia University. And what they did was calculate what the poverty rates are for these four groups, Hispanic, Black, Asian, and white right now with CARES in place. So this is what really happened. And so the Black and Hispanic rates are about 20% poverty. Asian families, about 15% are in poverty, and white families, 9%. And so these numbers here are basically what they were in 2019. And so with the CARES Act, poverty has not increased for these groups. I put a note here to say that the study didn't look at Native Americans, but Native Americans should be, that's something we should keep our eye on as well, because they have the highest poverty rates. They're about 25%. And so it would be interesting to know, we know that they've been disproportionately affected by COVID, both in disease and employment, because a lot of the employment of Native Americans is in, high contact, like casinos and in government and things like that. And so their employment has been negatively affected quite, and the stimulus money didn't get to them very fast and all of those sorts of things. And so it might not have had such a good impact on Native Americans, but I don't have evidence of that. All I have is these 4 groups. And what this study did was project that without CARES, the Hispanic poverty rate would have been 27, the African American would have been 25, et cetera, right? And so it looks like the CARES Act did protect households from greater poverty. And so that's good news.
Can I ask a question?
Yes.
So given that we don't know what Congress is going to do in terms of additional aid or relief, these numbers could come to pass, right?
Yes.
This is just like, okay.
This is just right now, right? We should keep doing this study over and over and just watch what happens, because it's, things are changing fast. So yeah.
I have one more question. I'm not sure if they noted this in the study, but was there reason that Native Americans weren't included with the data issue?
It's always a data issue.
Right.
There's not enough data collected on Native Americans. The sample sizes aren't generally large enough, but I feel like there should be more data collected on Native Americans. I mean, they really are a population that is very vulnerable in a lot of ways, and we need to have data on them. So yes. So I'd like to bring them up as soon as, if I can, but my problem is I'm data driven, and there's not a lot of data on them.
No, yeah, absolutely. I think it's just an important point to realize, especially for folks, maybe if anyone's on the call, like coming into the Humphrey School, or is a first year that's going to be maybe taking regression or something in future semesters. I think that that's something that you will likely find if you're interested in looking at the policy effects on Native American communities, is that Census Bureau, even data sources oftentimes have pretty weak data when it comes to Native American communities, and a lot of times that's referred to as statistical violence, if you're interested in looking into that further. But I think another interesting point on this figure is just the spread between the different racial groups, and we discussed this in our preparation, but
so really big here.
Yeah, the spread is so much larger for communities of color as compared to white individuals. And so, I think it just kind of shows how this is exacerbating, the coronavirus and the pandemic is exacerbating existing inequality.
Right. These groups here are much more affected by the coronavirus than white Americans. Yep, that's a good point. Okay. I have, one more good news. So rent. So there was something in the news about 30% of Americans, didn't make their July payment on time. So this is a different data source that I think is based on more units. So this is from the National Multifamily Housing Council. And so this is based on 11 million units in the United States, housing units. It's up here, 11.1 to 11.5. And they are seeing that, so in July, this is who paid their rent, their July rent, or whichever month, by the 6th, which is considered an on-time payment. And so in July, it was only 77.4%. And so, that's, close to the 30% that's being reported by another study. But if you look at 2019, it was, not that much higher. And so these numbers here aren't that much different than they were in 2019. And so I would say that in general, it looks like people are making their rent payments still. I mean, this could change dramatically if another stimulus check comes in, or if job losses, people can't continue to pay rent if income isn't coming in. And so this could change any moment. And so we're all keeping our eye on this as well. But I don't see a big problem in July yet.
Can I be a downer?
Okay, yes.
I'm sorry.
Go ahead.
I think this graph is really interesting, and something to consider too is it doesn't reflect necessarily some of the more hard to capture like changes in behavior for people. So what we're seeing is people are prioritizing paying rent perhaps, and I think it would also be interesting to see is like, are more people being rent burdened, which means like they're paying over 30% of their income, or severely rent burdened, or over 50% of their income, and seeing if that's shifting.
Yes.
Because I think people prioritize housing like really highly, so that they might cut back on other things before they give that up.
That is probably very true. And that'll come in the bad news part, which is coming up. Okay, actually, before I get to bad news, I put all the job stuff together because I'm not sure whether to call it, I think it's mostly bad news, but I'm not ready to call it that yet. It could be good news, so I don't know. So anyway, I just called it jobs over here. I'm being neutral. And so what we're seeing here, this is unemployment rate, and it's showing from 2000. So you can see 2 recessions. That's what the band here is. And so this is the unemployment rate for African Americans have the highest, then Hispanic, Latino, and then Asians and whites are about, the same here. You can see, when there's a recession, unemployment always goes up quite a lot, and it went up a lot in 2007 to 9 right here, but nothing compared to the spike we got right here. And so Hispanics, they were in the middle over here. They were hardest hit by unemployment. But the June numbers were better. It's coming back down. It's just, I don't know whether to be optimistic about that. It depends on what caused this. So if it's the Paycheck Protection Program, keeping all these loans went out and wonderfully, all these small businesses hired everybody back, that would be great news, right? That's the policy working like we wanted it to. But if it's that all the economy was reopening, everybody went back to work, and now we're seeing coronavirus spreading, and it's going to cause us to have to lock down again and prolong the recession, that's not good news. So I don't see a lot of evidence about what it is yet. I mean, I do have a little bit of evidence about the PPP, which I'll share in a minute, which isn't optimistic, but right now that's what's happening by race. You can see it's very different by race group. I also wanted to show women age group. And so here's our men and women, and then the different age groups. So the blue line is teenagers, and then here's young adults, and then older, 25 and up. The yellow and the gray lines are pretty much on top of each other. And so you can see that women had much higher unemployment as a result. I mean, it's coming back down. And then younger groups have had much higher unemployment. And so these maybe are the college grads who aren't getting jobs and things like that. And so those are groups to watch out for. Whether you can work at home or not is key, right? And so this is from American Time Use Survey, just asking people whether they could work at home. And so white workers and Asian workers and non-Hispanic workers, all, a third or so said that they could. But Hispanic and African American, much less likely to say that they can work from home. And so either they're losing their job or they're essential workers and have some health risks of going to work. Industries, so here is how much employment has changed over 3 months, just to show you that it's leisure and hospitality that's been hardest hit in terms of number of jobs lost. The bottom ones are mostly service, so you can see service has gone down. Even health, you might see in the news. So while we need health care to manage COVID, people aren't going into the doctor for other things. And so the health industry isn't doing so well. There's professional business services, and then retail of the goods sector. Retail is not doing so well. Okay, so that's the jobs. That's sort of a description of what's happening. Now I want to talk, this is still jobs. Here's more bad news, and this is about the PPP, which I think Tyler was alluding to. And so here's a study that it's not published. It's a working paper by MBER. but it's, you know, everything is happening so fast. It's not surprising it's not published yet. What this study has done is taken all business districts and broken them up into 20 categories based on whether they were least affected by COVID shutdowns or most affected. So a low number is most affected and a high number is least affected. And this one is business shutdown, whether they were most affected by that or decline in hours worked. And the way we would like, oh, and then this axis here is fraction of businesses receiving PPP. So we would like it to look the opposite of this, that if you're in a district that was affected, you should have gotten, a lot of the businesses should have gotten PPP, where it's the opposite. The least affected districts are the ones getting the PPP loans. And so it looks like it's not targeted well, which is kind of what Tyler was saying. Did you have anything to add, Tyler?
I don't think so. I haven't seen this study yet, so that's interesting.
Yeah. No, so it's, did the Paycheck Protection Program hit the target? And the answer is no. And then some other evidence. So this is coming out of Opportunity Insights, which is Raj Chetty, websites. You should go here. There's lots of interesting data there. What they did was look at, so change in employment, and these are the dates. And here's when PPP loans started. And the purple line are big businesses, so firms that are not eligible for PPP. And then the green line is really small businesses, 100 employees. And they have other graphs where you can look at all business sizes, but they're all right on top of each other. And so it doesn't look like, I mean, the green is a little bit higher than the purple, but not by much. So it looks like the, PPP loans did not seem to have an impact. The change in employment is the same for big and small firms. So it doesn't seem like PPP is bringing back jobs or saving jobs like they're supposed to. And it could be because they're not targeted well. So PPP, it looks like that's not, doing what we wanted it to do so far. Maybe it takes a little longer, but so far it's not. Here's the really bad news. And so this brings up to what Cory was saying, that, families may be prioritizing rent, but food is a problem. And so this is food insecurity rates with families with children. It used to be, I used to focus on this little blip right here all the time because this is the recession. Food insecurity increased a lot. And it's only now getting back to kind of pre-recession levels. But now that you don't even notice this blip. Food insecurity is, among Black families, a third of families with children are food insecure. And so policy response to deal with hunger hasn't been as robust as it needs to be. I think that more attention needs to be put on this. And then the other bad news that came out this week was about insurance, health insurance rates. And so here you can see health insurance change in people who were uninsured since the 80s. And so it's little blips here and there. There was a big increase of people being uninsured due to the recession here. And then Obamacare hit and a lot of people got insurance. And so uninsurance fell a lot, but then it's been slowly creeping up. And then between February and May, we've had 5.4 million people are now 5.4 million people more are uninsured. And so that's very distressing. So, our system is that employment is tied to insurance. And so people are losing their jobs and they're also losing insurance. From the policy perspective, what's interesting is Medicaid expansion states. So states that expanded Medicaid, like Minnesota, as part of the Affordable Care Act, versus states that didn't. You're seeing big differences. So in both types of states, ESI, which is employer-sponsored insurance, so this is insurance you get through your job, has declined, and this is just over 1 month. So these are big declines. But in Medicaid expansion states, people are going on to Medicaid mostly. Some are going to non-group, which is like healthcare.gov, where you get an individual plan. And just a little bit of uninsurance, people are becoming more uninsured, but it's a small change right there, where in the states that didn't expand, Medicaid is going down. a lot of people are going on to healthcare.gov, but this is where the uninsurance is happening. So policy can, have an impact. Okay, so that's all I had for my good and bad news. Anything you guys want to add right here? Do we want to stop for questions from the audience yet? Because it is 12:45. Or should I do my Europe thing? Because I really like the Europe thing. What do you think?
Maybe
a couple questions.
Maybe
a couple questions.
A question that focuses a little bit more on the bad side of things, but someone was asking about the potential for an escalation of the economic crisis as various other sectors of the economy experience crises. And I think that, Cory, maybe you brought it up in our earlier discussion of the idea of like cascading effects or like a domino effect. If sectors of the economy that up until this point had been able to hold out, once they fall, we might see further escalation of economic crisis.
Yes, I mean, that's definitely true. If there's, one sector is doing badly and that sector buys services from another sector, then there will be a ripple effect. And so, I mean, it all depends on how long this recession is going to last. So if a vaccine, is implemented, or if we all start wearing masks and we all get tested all the time, and we can go out, and really only isolate people who have it and do good contact tracing and all of that, and we can just get the economy going back somehow. And, I think things could get contained pretty quickly. But, the trajectory we're on right now, where cases are going up and people are becoming scared, so consumer confidence is a problem, people are going to stay home again, then the cascade of businesses, of the industries that are affected will grow. So that is definitely true. Very good point. Yeah.
Yeah, I think this and the next section where you're going to contrast European response, we've talked about this previously too, but it just all gets down to values and what we choose to value as a country, what we're going to prioritize. I mean, yeah, we'll get into it more, I guess. But...
Okay. Let me get to the European one, because I think this is neat. This is, how is the European policy response different from the US's? And so I read this great article that I have the source on, and I'll make my slides available because I have all the sources here and they're fun to read. I mean, there's just tons of really good articles out there. And so it's just interesting to contrast the US approach to the European approach. So the US approach has been to the economic crisis is to give money to people quickly as the firms lay off, and give money to firms to keep them afloat, but let the market reallocate the jobs. So the US, we have a very flexible labor market, which sounds like a good thing, but it means that we fire people very easily and rehire them. Where in Europe, they don't have that approach. Their approach has been instead to freeze the economy. So they are paying firms to keep workers on. So they have systems in place already. So, we use the systems we have in the US. Europe had ways to make payments from the government electronically to firms. And so they just paid them to keep their workers on. They basically are paying most of the wages of workers, and the economy just shut down and workers kept their jobs and stayed home. And so it's a very different approach. And so the US, we have to pass ad hoc legislation to get money out to people, where in Europe, they just have lots of automatic stabilizers. Their safety net is much more robust, and it just kicked in when needed. So they didn't have to pass a lot of laws and things like that. Ours is super expensive. So, the packages that have been passed, or the acts, and the CARES Act is the biggest part of it, is costing 19% of the GDP, and it's not targeted. It's going to lots of different people and industries that maybe aren't as hurt, who didn't need it so much. where the European approach is a lot less expensive. So in France, for example, their wage subsidies to freeze the economy only cost 2% of the GDP. So I think, the big difference is ours is very stressful. People losing jobs and being at home and, worried about rent and food, it's causing a lot of stress about reopening that we have in the United States, which is very bad for containing the spread, right? Where in Europe, there is not a lot of stress about opening the economy. They all have their jobs, income is coming in, people just can stay home and there's not a lot of pressure. And so they might be able to, in these countries that have instituted this freeze approach, to control the spread a lot better than we are, just because there's so much pressure to open the economy. But there are trade-offs. Like if the recession is protracted, the US will have gone through a lot of the pain of reallocating the market or the jobs to the parts of the economy that could creative destruction will have done that already. If the recession is very long, Europe is going to have to do that later. So, but their recession might be shorter just because the spread is contained so quickly. So there are pros and cons, but this is where you start to see values. You're right, Cory. So any thoughts you want to add?
Well, I was talking about this with a friend too, and they made a really interesting point about the type of labor we value. Mm-hmm. And I had never looked at it this way, so I thought I'd bring it up, that in Europe, you could almost say like they're paying people literally for the labor of not spreading disease and the labor of like staying home if they have kids and like managing that. Whereas in the US, like that is not valued in the same way. And so I think that if anything comes out of this, maybe like a rethinking of what type of work we consider actual work. And I don't know.
Yeah, that is an interesting way to think about it. That, we just think it's a terrible thing to not be working. Right. In the market, like in a way where your wages are coming in, where it is a lot of work to be at home right now, to take care of your kids and homeschool and all of that. And we don't value that. Yeah. Okay. So let's just, unless there's a question from the audience that I should address, I was thinking we could talk about policies that the US should be thinking about. So, a lot of these are in the news. So a lot have to do with existing policy revisions. So the $600 a week unemployment insurance benefits expire very soon, at the end of July. So should we expand? So there's lots of discussions about that. Maybe not that big is what some are saying. I don't know. So there's a lot of discussions about what's going to happen with that. The moratoriums on evictions and foreclosures are also expiring soon. So people are very worried about a huge spurt of homelessness coming soon. We are not doing a good enough job at fighting hunger. And so more funding in that direction, I think, is needed. State and local governments are going to need money soon. I think we need to fix the Paycheck Protection Program. And there's also a lot of talk about stimulus check, right? So whether there's going to be a second one. But I think that, this is also a time to think about new policies. And so that, these aren't big things that I'm thinking of here. These are just small things, I think. Okay, some could turn into big things. But I think public schools, if we want them to reopen, there needs to be money for that. They can't just reopen. They need more space. They need more protective equipment. They need more teachers. I don't understand how teachers are going to teach online and in person at the same time. If some kids are at home and some kids are online, we need more bodies there. So I don't know if I'm joking or not, but I have a plan. It's their new deal. We have a ton of people working at, not able to work and they're stuck at home, and teachers need help. And we should just, hire all of these people working who could work at home as kind of helpers to the teachers, like online help and things like that. I don't know, like an AmeriCorps model, something like that. So, but something needs to be done. Public schools need more resources, and with, you know, government or state, local governments funding down, I don't see them getting it right now. So we need to do something. I also think we need to strengthen automatic stabilizers. And this, you know, it sounds small, but it could mean restructuring them all so that they're a lot stronger. Like there's all antiquated systems. And then the other thing I think about is federal government is not doing anything for immigrants, anything good anyway. And so state and local government also need to be supporting immigrants more. So those are kind of the little things, little to big things I'm thinking of. But you guys also wanted to talk about just having a conversation about changing systems in a bigger way. And so I wrote down some of the things we talked about, but maybe you guys can lead this conversation. What are bigger? So, I mean, public schools, maybe we should not just give them money, but change how they're funded in general, which are very inequitable. You know, you talk about affordable housing, health insurance and employment. That connection is very, you know, worrisome. And then immigrant policy. Do you have other things that you wanted to talk about? Like this wider conversation of what systems we should be putting in place?
I mean, the US has just been historically very anti-welfare, and these effects that we're seeing aren't new. They're just more dramatic and evident because now not just the most poor people are being affected, and it's become more visible, and now people are concerned. So yeah, I don't know what else to say apart from that. It just seems like you have to go very deep to be able to like redevelop how much we care about the poor and resources go to who. Yeah. Tyler, I don't know if you had any thoughts on that.
Yeah, no, I mean, it's a softball question, right? But I think it just kind of, to me, goes back to the point that you were raising, both of you were raising in kind of the European to American comparison, and just that, you know, our systems are, you know, made up of policies, but they're really informed by values that on a larger scale. And so, you know, I think that what we're seeing and maybe need to do is reconsider what those values are, and doing that in a structured way, I think will be a challenge moving forward. But I think that, you know, that's what will be required for future kind of systemic change.
Yeah.
I'm going to jump back in here. I know we're down to the last 2 minutes, and there were some questions from the audience that we didn't get to, so maybe I will share those with you, Angie, and then we can think about there's other ways to. I also there was I also got a message from somebody saying they'd love to see the same talk in 3 months based on that data. Like that, there's almost like an ongoing need to kind of keep reassessing these policies and what's not working. But I thought I would just jump in. So if you didn't have a question answered, I will share those with Angie, and we'll see how we can get those back to people. Also, I'll post this talk and the PowerPoint on our YouTube page for the Humphrey. But I want to thank Tyler, Cory, and Angie for their time, and I will close it out with that and just say thank you, and enjoy the rest of your Thursday.
Thank you.
Thank you.
Thanks, everyone.
Bye.